Hi, my name is Michelle. I'll be your nurse today. May I start by confirming your name and date of birth?
Carafecto, 7/27/88.
What brings you in today, Kara?
Well, I am 10 weeks pregnant and I've been feeling nauseous lately, mostly in the mornings.
Mostly in the mornings. Well, congratulations on your pregnancy. Can you tell me how long this has been going on?
I'd say for the last 2 to 3 weeks, I haven't vomited at all. I just felt really nauseous.
Is there anything that makes it worse or anything that might make it better?
The smell of my husband cooking in the morning makes it worse. It's never happened before, and I haven't noticed anything that seems to help make it better.
Sounds like you might be experiencing something called morning sickness. It usually happens early in pregnancy and usually resolves around the end of the 3rd month. You might notice changes in your taste and maybe different cravings. You might have some even non-food-like cravings like ice. It can be triggered by the scent or even the sight of food, but what you might want to try doing is when you wake up in the morning, maybe have crackers or toast before you even get out of bed, and that might help resolve your symptoms. If it gets worse or you're noticing weight loss and you begin vomiting, make sure you give us a call and we can get you in and see what we can do.
Okay, is this harmful for the baby?
No, this isn't harmful for you or the baby. It's common during pregnancy and hopefully it will, like we said, resolve after maybe in a couple weeks for you.
Okay, I'll try eating crackers before I get out of bed.
On top of the nausea that you're experiencing, you may also notice some other GI alterations. Do you remember anything from a past pregnancy?
With my first pregnancy, I noticed my gums becoming swollen and irritated.
You might notice that again this time around. During pregnancy, hormones like estrogen and progesterone will be increased. And the estrogen increase will cause increased blood flow to your gums. You might notice that they might bleed a little bit easier. Another less common side effect are peptic ulcers because of this increase in estrogen. They decrease the secretion of hydrochloric acid in your stomach.
You mentioned progesterone increases as well. What effect does that have on my digestive system?
Increased progesterone can actually slow down your digestive tract. The increase in progesterone actually slows that moving of the smooth muscle and can cause esophageal regurgitation, and it can cause your stomach to empty a little bit slower than normal. This combined with a growing baby inside can cause you to feel a little burning sensation, a little bit of heartburn.
Okay.
What you might want to try to do to help this, maybe eat small, frequent meals. Try and avoid fatty, spicy foods. This might help with that reflux.
Speaking of my digestive tract, I've noticed I've been constipated lately.
Constipation is common during pregnancy, much like we just talked about with your esophagus and your stomach. Increased progesterone can also decrease the motility and peristalsis and cause increased water absorption in your colon, leading to constipation. There are other causes of constipation too, though, so that could be the food you choose to eat, not enough fluid intake, and your intestines can be displaced because of the pregnancy. You're also going to want to be careful because straining with constipation is also one of the leading causes of hemorrhoids during pregnancy. What you're going to want to do is make sure you drink a lot of water, increase your exercise, and watch what you eat.
I'll try that.
Looking in your chart, I noticed that you have high cholesterol. Is that correct?
Yes.
High cholesterol puts you at an increased risk for the development of gallstones during pregnancy. The increase in estrogen actually increases your body's total cholesterol levels, and the progesterone increase actually causes the smooth muscles, like we talked about before, to kind of slow down, and this impacts the gallbladder by slowing down its contractions. This is called cholestasis. The increase in the cholesterol and the bile and the slowing of contractions is what puts you at risk.
How will I be able to tell?
Cholestasis might be a little bit difficult for you to identify. You might notice your skin might be a little bit itchy. You might notice a little bit of yellowing to your skin, which we call jaundice. And you might notice that your urine appears a little bit darker, which is due to excess bilirubin. Gallstones, on the other hand, might be easier for you to identify. usually happens after a high-fat meal. You might notice pain in the right upper part of your belly, right up here. Nausea, vomiting, that yellowing to your skin you might notice, and sometimes these symptoms will go away on their own. And if they don't, if they persist and continue for 1 to 2 hours, I want you to give us a call and seek medical attention.
Okay, thank you for letting me know what to do.
Do you have any other questions before I let you go?
Yeah, is it normal to have abdominal pain during pregnancy?
Yes, abdominal discomfort is normal. Not all abdominal pain during pregnancy is a sign of a severe complication. There are common causes that can cause this discomfort. Gas and bloating, constipation, round ligament pain, uterine contractions that you might have heard of Braxton Hicks. They're infrequent, irregular, but if you do notice anything out of the ordinary, if you have heavy bleeding, unusual discharge, anything that concerns you, I want you to give us a call, okay?
Thank you, that helped a lot.
It was very nice to meet you,
You too,
Tara.
thanks.
We'll see you next time.